And now we'll focus on anesthesia for neurosurgery. You were called to evaluate a patient in the ER. The patient was brought in by the EMS after the patient had a seizure. The patient has been suffering the last several weeks with a progressively worsening headache. The last few days, the patient had severe nausea and vomiting, according to the caregiver. Today, the patient had a seizure and was immediately brought to the ER. Being concerned of a cerebral mass, you attempt to perform a thorough history and physical examination. The patient has an altered state of consciousness and is not able to provide any helpful information. According to the patient's caregiver, the patient has had a steady decline in cognitive and neurological function. Patients with intracranial mass may generally also have a progressively worsening headache associated with increased nausea and vomiting. The clinical presentation of the patient may vary depending on the location of the intracranial mass. In addition to the common presentation, which is the general decline in cognitive function, plus or minus a headache and nausea and vomiting, the patient may present with signs and symptoms which may help identify the location of the intracranial mass. For example, a supratentorial mass